The World Health Day is usually celebrated on April 7th every year. It is a day set aside to create awareness and to highlight a health priority area. To emphasize this, good health and well-being is goal number 3 of the 17 United Nations Sustainable Development Goals. According to the World Health Organization, primary health care is a whole society approach to health and the first point of contact between the population and the healthcare system. Globally, health matters remain an issue of concern. In an ideal situation, the primary healthcare system should provide general health service in terms of health promotion, treatment, and rehabilitation. In Nigeria, the healthcare system continues to be an issue of great concern as the sector has been bedeviled by several challenges like the lack of proper infrastructure, inadequate medical facilities, non-payment of salaries as it went due, brain drain, and lots more. In the year 2020, the COVID-19 pandemic struck unexpectedly and seemed to have brought to light the challenges that beset the sector. There were so many backs and forth regarding the issues of setting up isolation centers, provision of protective covers, and hazard allowances for frontline personnel. Nigeria's healthcare system had lots of struggles before the pre-corona era, and now in the COVID era, can we really say the sector has improved?
To answer that question and lots more, let's speak to a research analyst with our partners at Budget. Hello, I'm Charles Emuze. Welcome to Oversight. From our research, we've discovered that the average Nigerian spends just under 1,700 naira on health. Now you ask yourself, what could 1,700 naira get you? It could get you some drugs, say paracetamol, a cough medicine. It couldn't get you a kidney transplant. It couldn't get you surgical services. So if Nigerians have that little and spend that little, it means that this money, these facilities, these services need to come from somewhere. And this is where primary healthcare comes in. This is where tertiary healthcare comes in. And these speak to the broader questions of what role the government and perhaps the private sector are playing in providing healthcare. The questions that need to be asked from my perspective are just what is the critical issue? Where does the bulk, or where is the bulk of the spending meant to go? Where do the bulk of the problems come from? And then you meet these two questions and challenges together, and then you find a solution. Backing that up with actual data. It's very, very often I see that, for example, in this COVID-19 Special Intervention Fund, the 2020 Amendment Act, I noticed that there was a lot of spending on infrastructure, a lot of spending on health facilities. And the question again remains, or the question comes up that what does the government actually want to achieve with this? What kind of baseline data do they have that inform them to say, okay, this is where the bulk of the money is going to? And even at that, what mechanisms for monitoring and evaluation exist for the government to say, hey, this is what we've been able to achieve with this money that has been dispersed. These are the targets we've been able to meet. These are the solutions we found to these pre-existing problems. But time and time again, you see a rush to solve problems. I think we have a bias to action in Nigeria, and it's not backed up by any real evaluation of the problem. Available data shows the average Nigerian spends a total of 1,700 naira on healthcare in a year. Now, let's go back to our research analyst as he tells us more about budgeting for healthcare in Nigeria. Looking at Nigeria's health budget, 2021 figures, it's about 134 billion naira for capital expenditure and 415 for recurrence. Now, this is a huge jump from the previous year, where you had about 51 billion for capital and 363 billion for recurrence. Now, it's obvious that this jump came about due to the realization that spending had to be increased for the COVID-19 pandemic and the resulting pressures on health capacity and personnel and emergency funding. But it's hoped that this increase will be sustained because there are various challenges and problems that the health sector has that go beyond COVID-19 and the global pandemic. Looking at the trend of increase from 2016 to 2021, there have been successive two-year jumps. I noticed that from 2016 to 2017, the increases were less than 5%, but from 2018 to 2019, there was a considerable jump of over 50%, and 2020 and 2021, of course, had the jumps from around 400 billion to around 500 billion. Now, this, of course, includes some major projects of which the 2021 budget has allocations for. Some of those major projects are the Global Alliance for Vaccines and Immunization. Another large portion of that spending is going to national primary healthcare development. Now, these are, of course, critical and flow from the enhanced surveillance and vigilance that Nigeria decided to put forward regarding COVID-19. And, like I said earlier, these things are good in and of themselves, but they require maintenance, they require sustainability, and they also require better management. So this has to be looked at in the framework of just how much priority the Nigerian government is giving to health, giving to education, giving to social services. A lot of Nigerians, more than half, live below the poverty line. And if we were to look at, say, per capita spending, it's about 1,666 naira per person. Now, if you look at that and you compare that with the minimum wage or the poverty line, you can see that Nigerians per person spend very, very little on health. That's out-of-pocket spending. And this needs to be augmented and sort of cushioned by better access to healthcare, better access to health personnel and health services to offset that minimal amount of spending that they have. So looking at the major projects that the government has allocated for, in our research we discovered, among other agencies, line items that were duplicated. Now, this also speaks to the issue of budget padding and how capital projects are padded to look like recurrent projects, and sometimes vice versa. But for the health sector, it was actually very, very revealing that the very agency that should be taken as serious as possible in the light of a global pandemic and in the light of a dampened spending on health had the highest number of duplicated projects. The Federal Ministry of Health had the highest number of duplicated projects. Specifically, the National Primary Healthcare Development Agency had about 115 duplicated projects. This is bizarre because you would expect this agency and the ministry in general to be as scrutinized and taken as seriously as possible. This is not just about economic growth. This is about saving lives. This is about maintaining the health of a nation when it is extremely vulnerable. So a lot more attention, of course our organization does give a lot of attention to budget analysis, but a lot more attention should be given to just what is being itemized in the budget as regards spending on specific projects.
Now, the COVID-19 pandemic came with a whole lot. Lockdowns were a major part of it. During the COVID-19 early days, where we had lockdowns across Nigeria, more of funding was directed at infrastructure. More like saying, infrastructure became a priority instead of health matters.
The health sector received a considerable boost in 2020, and there were, of course, spillover effects to 2021. The Appropriation Amendment Act of mid-2020 had a large amount of spending directed towards health. About 89 billion naira was allocated to health, and this was comprised mainly of allocations to tertiary healthcare agencies, teaching hospitals, the NDDC, NAFDAC, the pharmaceuticals agencies, of course, for research, for preparation of vaccines. And the scrutiny for this Appropriation Act, also coming from our organization, is showing that while there's a huge allocation to health, 89 billion, there was far more allocations towards infrastructure. I find that confusing because if during a lockdown period you're spending more on building roads and servicing contracts for the building of those roads as opposed to health, it really does put to question where your priorities lie as a government. The idea is that people can't move around, but they need to stay healthy. So why not direct more of that funding towards health? So this is something that is also very critical and needs to be watched going forward. There is a growing discontent with how the government is treating doctors, apart from the broader problems of a lot of doctors leaving the shores of Nigeria for greener pastures, as it were. The doctors in Nigeria are embarking on industrial actions because they are not being paid well enough. The average hazard allowance for a Nigerian doctor as of 2020 was 5,000 naira, 5,000 naira a month. A senator of the Federal Republic takes home over 100,000 naira a month for newspapers alone. Now, doctors, as at last year and this year, and for a long time in the foreseeable future, are frontline workers. They are the most exposed, they are the most vulnerable, and having a situation where their salaries are in arrears, having a situation where their COVID-19 inducement pay is being held back. This is both at the federal and at state levels. You have to ask yourself just how incentivized they are to consider their Hippocratic oath, if that comes into their minds at all. These considerations for health workers, again, show just what type of prioritization the government is placing on its healthcare workers. And this has a direct effect on the health of the nation, because if your frontline workers, if your core medical personnel are not being paid, are not being taken care of, then you cannot expect the negative outcomes of the pandemic to go away. You would further compound the problem by neglecting your health workers and the citizens at the same time. So looking at spending, you ask yourself just how much is being allocated to personnel costs within these agency budgets, federal medical centers, teaching hospitals, core health agencies. How much is being given for their personnel, for their lab scientists, for the nurses, for the doctors? And there are two key issues that really stand out. The first of them is there is always a disparity between what is budgeted, what is approved, and what is dispersed. A lot of our research shows huge variances and deviations between an approved amount and the actual amount. Some states, the Federation doesn't do this to my knowledge, but some states release quarterly implementation reports, and you can see just how much money has been approved and how much money is being released. There was some data we got from Kano that showed a deviation of over 80% of the approved and the actual. So you ask yourself just what is being done with these paltry sums, if anything is being done at all. So this, of course, calls for increased oversight, better management and administration of the accounting units, of the auditors, of the National Assembly and State House of Assembly members and of civil society to ensure that the budgets are tracked from the release of the circulars to the implementation reports. People need to know where this money is coming from, how much precisely is being released, and what precisely is being used for.
Still to come, we go up north to track some projects. Stay with us. Welcome back. Let's go to Adamawa State in northeast Nigeria to track some projects. Here is what you need to know about Adamawa State.
Adamawa is a state in northeastern Nigeria, whose capital and largest city is Yola. Adamawa is one of the largest states of the country. It's bordered by the states of Borno to the northwest, Gombe to the west, and Taraba to the southwest. The major occupation of the people is farming. Agriculture is the mainstay of the economy. Their cash crops are cotton and groundnuts, while food crops include maize, yam, cassava, guinea corn, millet, and rice. Adamawa State has 21 local government areas and 3 senatorial districts. In the 2021 budget, Adamawa State received a total sum of 1.84 billion naira for zonal intervention funds known as constituency projects. Gire is a town and local government area of Adamawa State. In 2018, the sum of 72 million naira was allocated for the construction of 3 primary health care centers at 24 million naira each in Yola North, Yola South and Gire areas in Adamawa. The agency responsible for executing these projects is the National Primary Healthcare Development Agency. These projects were initiated by Honorable Lawal Abubakar. He represented Yola North, Yola South, Gire Federal Constituency in the House of Representatives of the 8th Assembly.
Honestly, we have lots of challenges as regards our health as a community. We had wanted to reach out desperately to the government for a long time because a local hospital has been built for us, but they haven't started operations or opened it up for us to gain access. For instance, when we have health challenges, especially childbirth and maternity-related challenges, most women lose their lives before we can rush them to the city for them to have access to immediate health care at the big hospitals. The road isn't even good enough to do so as well. In the process, people die. This has happened before and even happened to me and my daughter. When it happened, it was late at night around 10 p.m. She was pregnant and had an emergency. I was called upon to help with the labor and delivery. When I got there, we tried and tried, but we couldn't do much. If there was a healthcare center closer, that wouldn't have happened. We would have gotten timely medical help and care, but there was nowhere close.
roƙon gwamnati ya taimaka mana da asibitin nan domin muna fuskanci damuwoyi da dama a wannan wuri.
We are pleading with the government to come to our aid and help us with the opening and operations at this hospital because we're facing enormous health challenges in this place. When our children are sick, before we leave here and get to Damare or Bajabure or even the city in Jimeta, Most times we lose our children to this acute and dangerous malaria. Our children keep dying because of lack of access to timely and good health care. This is a huge challenge for our health care in this community. And so we're appealing strongly to the government to come to our rescue and show us mercy, to open this hospital so we can get adequate health care attention that we urgently need in this community.
Akwai typhoid, akwai malaria. A gaskiya wannan wuri muna brokon gwamnati ya taimaka mana ya dube mu da idon rahama, ya taimaka mana ya bude mana wannan asibiti domin mu samu taimako.
Our team visited one of the project sites, and this is what
May the project be completed and furnished, equipped, so that the community will enjoy what this present government is giving to the masses. Due to the challenges we are facing, we have to also condemn another classroom so that we will form a laboratory. We have to divide the classroom into two, part of it for science students, then the other half of it is the laboratory. Despite this, we have to also condemn another one classroom again for the staff. So automatically we have condemned 4 classrooms based on the challenges we are facing. So now we have less classrooms being remain for the students. Despite this, now we are talking about the senior secondary school. So now if you go back to the junior secondary school, the junior secondary school have to share the same classes with the primary school pupils. The primary school has to attend their classes from morning to 12. Then the junior secondary schools share the same classroom with them from 12 to 4. So we are pleading to the government to give us additional more classrooms so that we will so that we can fight out these challenges. These 2 blocks of 6 classrooms were built by the community. Though the classrooms are still having challenges, the roof have been leaking. So at least we need renovation. Despite this furnishing, we don't have enough furniture for the students. In fact, most of their seats and desks have been broken. Though the school head has been trying, every time at least, they have to repair some broken ones, they have to construct new ones, but still we have challenges about seat. We are pleading to the government to assist us on these challenges so that we may have more classrooms.
So we are talking about database management system. I say database management system is
Just so you know, in the year 2020, constituency projects were funded 100%. This basically means the examination hall you've just seen very likely cost the federal government 50 million naira. Now, away from education and back to health, there is a popular saying, the first wealth is health. By this, I'm asking that you do all you can to stay healthy. Practice social distancing, wash your hands regularly, and wear your face mask. While you are doing that, we also urge you to get involved and ask questions. On this note, I say thank you for watching. I'm Charles Semuze.